Let's see if I can remember this stuff. All right, welcome to the recovery subcommittee of the ADPC. As a reminder,
Hey, there's Frank.
please have your cameras off if you're not a committee member. We ask mostly that people hold their comments until the end, although this group usually allows some of that. So just drop something in the chat if you're not a committee member and you want to chime in. And then we'll take some roll call. Will.
Well, I'm going to kick that to Ashley, but I did just notice that we have quorum now, so
Oh,
that's cool.
perfect. Great. All right, Ashley, thank you.
Yeah. Can everybody hear me okay? I think it froze. Hello? Hold on, guys. It froze on me.
Uh,
Okay. But can you hear me?
Yep.
yep.
Okay, wonderful. Sorry about the delay. All righty. I'm gonna call off everybody's name. Please just state if you're present. Got Jared.
He'll be absent today.
Okay. John.
Here.
Thank you. Frank.
I'm here.
Wonderful. Stephanie.
Cameron, here.
Amanda.
Here.
Steve. Stephanie Mendenhall. Stephanie Castaneda. Todd.
Here.
Stephanie Sloan.
Here.
Ed Smith. Craig Mosbeck.
Here.
Brian Hodges. And Sharon Fitzgerald. Okay, that concludes roll call and we have hit quorum. Back to you, Tony.
Ashley, you're back.
Oh, now you're mute.
I'm so sorry. I am working with one screen here, so I had my roll call pulled up and I don't know where that cut me off and froze me. Was Brian Hodges or Sharon Fitzgerald here?
Neither of those
That?
will be
Okay.
here. Neither of them will be here.
Okay, great. Well, the meeting is still recording. Don't mind me. Sorry about that. All right. Back to you, Tony.
Cool. So for the agenda today, we'll have some director updates. Then we'll go into voting on our core RCC definition. We'll dive back into data a little bit more, and then we'll have some time for public comment. So with that, Annalise, I'll pass over to you.
Thanks, Tony. And Ashley, I will share while you were frozen, we were all complimenting you on having like the most serene frozen face we've ever seen.
Technically, I'm in the middle, like I'm on vacation. This is a middle day, so that would be why.
Ashley is literally coming in today just to get out the newsletter and to work with all of your lovely faces, which is very appropriate. That's my first announcement. The newsletter that comes out tomorrow is all about recovery. There's a bunch of other good stuff in there too that I'm going to mention, but Will did a great write-up from the Recovery Summit, and it features the speech that Megan Smith gave at the summit and a little report out from the conference. So it's a really nice piece. Maybe we should forward it to the whole committee, Will, just to make sure everybody sees it. And if you're not getting the newsletter, please, and would like to, just put a note in the chat. You do have to opt into it. So that's exciting. I will also mention, I'll do the prevention updates first. The prevention committee, both this month and next month, continue to talk about their Center for Excellence idea and the comprehensive plan, and are very focused on their House Bill 3321 prevention assessment. We put some links in the newsletter this week. They're doing some surveys of primary prevention provider organizations and schools. Our recovery school friends, but also anybody who works with a school and does any kind of primary prevention, if you could pass the survey along to the appropriate folks in your district or fill it out yourself, that would be really great. Health, I can't believe I just blanked on this. It's more on here. I'm so embarrassing. Health systems and health, safety, and interventions.
Yeah.
Health, safety, and interventions. HS&I meets early next week. They continue to be really focused on naloxone. Next week, they're going to be talking a lot about expired naloxone. That's something that we are hearing more about, folks who have soon to be expired naloxone or expired naloxone. So figuring out why that is, what's happening with our distribution, what the rules are around expired naloxone, and what folks need to know about it. The treatment committee is talking about a clinical provider survey. So they're probably going to be working with Third Horizon as well to develop, to develop a statewide survey. OYA met and talked about, you're going to hear a little bit about it, their recommendations to all of you about best practices for youth recovery centers. They also started talking about family care plans, which are great interest to them. And then the commission met earlier this month to talk about, we did an exercise to really ground ourselves in the recovery-oriented system of care, and to start to think about how we bridge individual outcomes that you all and your subject matter expertise are working on every day to our big statewide outcomes so that we can develop more guidelines for state agencies for programs and funding. And we will continue that conversation next month. We're meeting in June in person at Miracles Club, which is super fun. So if anybody wants to come join us in Portland, it's a public meeting. You're very welcome. And then finally, Opioid Settlement Board updates there. There will be a request for grant opportunities this fall that is one-time funding. It's open. And so I don't want to say it's like real health transformation. It will be open for funding opportunities across the continuum, but it is only one-time $13 million. And then the settlement board is going to hopefully put together a plan for ongoing funding for the rest of the term of the settlement. We could actually make a plan to fund things for a decade, which wouldn't be forever. That's not permanent funding, but that would really help fill some gaps for the next decade. So that is all my updates. Let me know if you have any questions.
And any questions for Annalise? Yeah, I will say my term as chair for the ADPC ends next month. I think I don't know how long it's been, 6 years. No, it's been a while. So happy to pass it off. And it's been a great ride. It's a lot of work. So I have more time for this committee specifically that relates to Will. So I'll be more available for you, Will. Okay. All right. So Will, do you want to start sharing the slides?
Yeah. No. All right. So, yeah, I mean, these are sort of the typical intro slides, but I still like to put them up on just to kind of get us all on the same ground again as we move into this meeting. So, recovery identified 4 strategies in planning for comprehensive plan. Recovery community centers, expanding those, which is our top priority right now. That's what we're working on. And eventually we'll be working on recovery housing and peer services and recovery-friendly workplaces. When it comes to expanding access to recovery community centers, well, we have this baseline. There are currently more than 10 RCCs and no directory of these. And depending on a definition, these numbers might even vary. So spaces are unknown and identified. So right now we're in the middle of defining these. We're about to finalize a core definition today, or at least have a vote to do so. We're going to talk about youth RCCs today as well. And, sort of really we're hitting all of those near-term elements right now. And in addition to those, we're also talking about data. So we're moving along more quickly than we had figured, which is awesome. So I just want to talk a little bit about engagement here. As we're working on this definition and recovery stuff, I think it's been we had 4 meetings, a recovery committee, in which we discussed this definition in some way or another. On top of that, we've really developed this kind of close relationship with the Youth Addiction Alliance, and I'm really looking forward to that relationship moving forward. I think we're going to have a lot of overlap when it comes to spaces, when it comes to data, and it'll be really great. Then we had the Recovery Community Center Summit, where leaders, recovery leaders from around the state came, and we talked about things like this definition. So, and then also meeting with OHA about this definition. So this has really made it around. A lot of people have been able to comment on this definition. So that's all been brought together, and I think we have something that's we can be proud of. Okay. Timeline for definition work. Today, we're going to vote on the core definition for recovery community centers. That's the one we've been seeing. People in this committee have probably seen it, I don't know, half a dozen times now. At least some of you. Maybe others haven't. So we're going to go through it once more. So that's today. June, we're going to have Oregon Youth Addiction Alliance present to the recovery committee on sort of an additional component to add on to that core definition that is about youth RCCs. So today we'll vote on the core definition. June, we're going to get a presentation from the youth, and then July, we're going to vote on that youth component. Yeah, so this is the core definition. And Tony, did you want me to go through this, or yeah, I can. Okay, cool. So core definition. I know this is big. A lot has been added to it, and I've had to make the font on this slide smaller several times. I'm going to read through it just for those who might be on a phone or those who would like to hear it out loud. After this, just to give you a heads up, I'm going to bring us to this page, which is just like sort of those main chunks of that definition pulled out. So a recovery community center is a non-residential, peer-operated center, usually with a paid director and recovery staff. A recovery community center offers drop-in hours, peer support, recovery, and social support services. Participants in recovery community centers are youth and adults experiencing challenges or obstacles consistent with recovery from a substance use disorder, or those in remission from such obstacles. Recovery community center services are typically free of charge to participants. If a recovery community center does not offer culturally specific services specific to an individual's needs, the center must be able to direct the individual to services. A recovery community center is designed to help participants build recovery capital, resources available to an individual that can aid in said recovery, by sponsoring social activities with other individuals in substance use disorder recovery, fostering relationships among individuals in substance use disorder recovery, navigating community resources in connection to social services, hosting mutual support meetings, connection to employment resources and opportunities, advocacy education, and volunteer opportunities. I'll leave that there for a minute.
questions from committee members, comments. I have one. I have one edit.
For it.
Okay, so and committee members, correct me if I'm wrong, but w- when we discussed the population being served, I believe we had some intent on ensuring that individuals who were attending were progressing in their recovery, like making efforts to progress in their recovery. And I don't see that captured here. And I believe the crux of that was ensuring that like the recovery centers didn't turn into just like shelters. Recognize that people may come and they may still be needing to make progress in their recovery, but they were like actively engaging in their recovery as sort of a requirement.
And I think at one point, Tony, if I remember right, we'd used the terminology, something along the lines of a commitment to abstinence or something along that, or I don't know, but then that gets problematic too. So,
Yeah, no, I
uh,
remember there was sort of that discussion. And then I think we landed on something like making efforts towards recovery or progress in recovery or something like that, just so it was clear about who they're intended to serve.
And so this would
I think it would fall,
under like,
I think it would fall right there, consistent with, yep, that line right there, right after, are those in remission from such opticals, you know, engaging in or demonstrating efforts to improve recovery, improve sustained recovery, or something like that.
cool. That makes sense to me. I don't know how the rest of the committee feels. I should.
Yeah, the rest of the committee, correct me if I'm wrong, but that's the only thing that I see missing.
Yeah, Tony, I want to say, yeah, we don't want low barrier day centers, right? And so I think that that's the caveat here is that how do we prevent it from turning into a low barrier day center? And so I think that, if we look at Sam's definition of recovery, just making that progress to improve, it definitely needs to be added in some form in this definition.
Yeah, I like the the mention of Samsha's definition of recovery. I think it's really important for us to kind of align with that. I don't know how to wordsmith it into this definition necessarily, but I think, progress towards a recovered lifestyle, however we word it, or, commitment towards a recovered lifestyle is going to be really important. And I actually experienced for a moment what it's like to not have this defined like initially and then have to kind of walk through what it looks like to be a low barrier day center and then to correct while services are already being provided. It was, exciting and fun and it kept you on your toes, but it's nice if there's like, oh, this is how we present that, especially if we're talking about, opening up more centers across Oregon, having that there already is going to be very beneficial for all.
Yeah,
If I could ask.
Amanda had a fun run with that recently.
Yeah, it was about a 6-month fun run for sure, for sure. But something the way that we worded it, to individuals is you have to have some sort of meaningful effort to your recovery journey. So, that could mean going to meetings, going to recovery events, getting a mentor. But I think that we use the terminology like a meaningful effort.
Okay, that's cool. And I guess one question I just have thinking this through is, um, we're putting it in this definition. How do you show that someone is making a meaningful effort or progress? Is that something we need to talk about in the definition?
I would say no, and because it's going to be person to person.
Yeah, I don't know if I'd put meaningful in there. I think just progress. Steve, go ahead.
What about something about them being engaged in their own recovery or something like that? Or engaged in, I don't know, just something I popped into my head.
I'm hearing add in some expectation. I know there were many different versions I just read, which sounded good. Yeah, adding some expectation to participants somewhere in this definition. And, yeah, Stephanie.
I just am curious about this. I'm not being facetious. I was wondering though, if we say that somebody has to be showing improvements in their recovery, do we also have to define what that is?
Recovery.
Because just like no, like define what is it, what is improving my recovery? What does that look like? Because I'm just thinking back to my days in sort of conversation with people who are in the struggle and trying to support them. So I was just wondering, like, do we also then define what does it mean to be improving in your recovery and or not, or is that sort of open to interpretation?
No, that's a good call, Stephanie. So we could say, or those in remission from obstacles, participating in, community center supports or or something like that in community in recovery community center supports or something. Like if you come there, you got to be like participating in the stuff. You know what I mean? You can't just come there to charge your phone and just hang out and not have no interest in recovery.
And something, to note also is, are we talking about just recovery center services right now or things that happen as a result of peer support in those?
It'd be either or.
Oh, sorry, Todd.
Todd, go ahead.
I don't know if this is a helpful construct or not, but in the recovery school environment, every student has their own, what we call an individualized program of recovery. And on there's 2 or 3 like goals. And then when they start to be either stagnant, going backwards, whatever, then we come and we revisit that. And then we say, now we have defined what is meaningful progress to you, and then we can hold you accountable to that. And if there's a certain period of time goes and it either goes down or what have you, then we have conversations about seeking services elsewhere. So I don't know if that's a helpful construct or not, but the individual program of recovery, in some ways, it looks a little like a treatment plan, but way less formal than that.
The thing that comes to mind for me is that we have people who are in formal services accessing peer support who might have already created like a recovery plan or a service plan or personally identified goals. But sometimes people are coming to the recovery community center just to be with people and socializing and engaging. And so I lost it now. I wish I would have wrote it down, but I took something that I think Stephanie said and something that Tony said, and it's really like they must be engaging in recovery activities. They must be engaging in personal recovery. Putting a plan on it, because not a lot of people coming into the recovery center have a formal plan. I'm done, Amanda.
Yeah, I would agree with Stephanie is that, that there's 2 different types of individuals that come to our centers. One of them are informal services, have a peer mentor, and other ones do not. And there's people that have 20 years in recovery that come to the community center, right? And then there's individuals that are still, trying to identify what recovery looks like for them. But the people that are coming into the center are engaging in some way in the recovery services that we're providing to the community. And the ones that don't show that, and like Tony said, are like there to, grab a soda or charge their phone or get out of, the weather. That's the difference between, or the issues that we see with using our services, but not actually being in recovery or showing a direction in recovery.
What if we say this, or those in remission from such obstacles that engage in the process of recovery?
Can you repeat that, Tony?
Yeah, so it'd be at the end of, participants in recovery community centers, dot, 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 are those blah, 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 are those in remission from such obstacles that engage in the process of recovery?
What do people think about that, like substance wise? I'm wondering if I can, take it back after this and just wordsmith that just a little bit, but keep the meaning.
I like it, and I think that I like that because I think we all recognize there's many roads, but they need to be on one, toward recovery.
There's many roads, but you got to be on one. All right, I like that, Steve. All right, Will, you feel good?
I feel good, and so yeah, I got that. I got what you just said, and I wonder if we can just vote, knowing that I'm gonna wordsmith that, but not make any like substance changes.
Yeah, well, if there's no other edits, then I'd request a committee member to bring forward the motion
Can
to.
we, I would like to show just the youth bullet points before we do that.
Oh,
Just,
okay.
and then,
And I do have a comment about another question, another sentence in the.
Okay.
So if the next sentence says, if a recovery community center does not offer culture-specific services specific to an individual's needs, the center must be able to direct individuals to services, and that may be hard for rural areas to do so. So I would like to just make the amendment of, make an effort or an attempt to be able to direct individuals to services.
I'm glad you brought that up. Yeah, that's,
Yeah.
yeah, I hear you. Man, can you say what you said for that last piece of that sentence again?
Instead of saying must, create or make an attempt to direct individuals to services.
So must make an attempt.
Or take out the must and then just say make an attempt. Yeah.
Make an attempt.
Center will make an attempt to
make an attempt, make an effort. Yeah.
Okay.
Yeah, and Craig put some language in the chat that might be helpful, Will, when you wordsmith that.
Okay. Sounds good.
Yeah, I'm just trying to get to, they should be aware of any available services that they can refer them to.
If they're there, right?
Oh, okay.
Right.
Okay.
Yeah,
Gotcha.
it was a good sentence.
Yeah, I like that. Thank you. There's not anything else on that slide. I just wanted to, well, here's that short slide with, all those things. Just wanted to share a bit about what the youth feedback was, and they're going to give us a more full presentation in June. But before we vote, I wanted to share that the youth sort of, classified things in like 3 areas. One is to ensure structure, safety, and boundaries. That the staff be trained on youth work. Youth should be offered onboarding training as well as the peer. Centers must have trauma-informed protocols. one of the big ones was clearly defining boundaries and eligibility of access for certain age cohorts. Access to a center, community integration, need to address geographies, of course. This might require an RCC to be in a sort of shared spot in certain geographies. Transportation is huge for the youth, especially by geography again. Required access to resource navigation, transportation, youth peer support training, cultural supports, language supports, and transition planning was one of the um, key sticking points. I think it should be like big and bold in a dot here, but it's not. The youth emphasized that in transitioning maybe from 14 to 18 youth center to whatever it would be, 18 to 25. I'm not sure the exact number, but a lot of people get lost in that transition or take a few steps back. So that is key. And then governance should involve youth leadership opportunities, include participants in organizational decision making, youth-led programming, youth-informed choices, and help youth with community leadership, sort of like volunteer opportunities. I just wanted to give that to everyone for just kind of a preview of what we're going to get next time, and that this will probably be added to our definition as like a third paragraph. Is kind of what I'm thinking. Okay, now we are on a vote on the core definition. I believe Tony was going to ask. What were you going to ask, Tony?
Yeah, if committee members are so moved and there's no further discussion, would a committee member entertain a motion to approve? Or provide, not entertain, but provide a motion to approve.
I make a motion to approve the draft for our core definition.
Okay, do we have a
I'd second that.
Okay, we have a motion and a second. Is there any further discussion before full vote? Okay, hearing none, I will pass it off to who's taking the vote here? Is it Ashley? There you are. Okay.
Hi, everybody. All right. Hopefully I don't freeze this time. All right, so we're gonna run the vote. I'll say your first name and please just state yes or no. Tony,
Yes.
John,
Yes.
Stephanie Cameron,
Yes.
Amanda
Yes.
Wivel, Steve Sandin,
Yes.
Todd Nicholson,
Yes.
Stephanie Sloan.
Yes.
Okay, and did I miss anybody? I don't think I did.
Yeah, Frank, I say yes.
Right, got it. Okay, thank you. All right, back to you, Tony.
Okay, awesome. Well, we got a core definition and we have a little more work to do with the Oregon Youth Addiction Alliance to finalize it, but great. This is great. And it's gonna be kind of boring wordsmithing stuff sometimes, but this is really laying the foundation for what we're trying to build. And it's important to have a definition in the beginning. So thank you, everyone, and thanks, Will, particularly for navigating through all of our thoughts, and opinions about it. Appreciate that. All right, now we're going to move on to a equally fun discussion around data. So the first thing that I wanted to do is provide my perspective on data and then have a little bit of a discussion. So the way that I see the practical way I see us moving forward to sustain these recovery centers is through two different ways when it comes to data. One is internal data that we know is important to evaluate the efficacy of our services. And then the second data point is really the data points is really to external stakeholders. So these might be things that are not as important to everyone, uniformly, but they're important to stakeholders, particularly those who fund us. So what I wanted to start out with real quick is just a quick brainstorming session on data points for external stakeholders. And what do you guys think some of the things we might want to track to, the general public or grantors to the government, donors, that would be important data points that show that we're effective, as a service type. No, it's a little different than what you have on your screen, but I want us to think about that because we can know they're effective, but what does the general public think? Okay, I'll call on people. John.
Thanks, Tony. Um, I think the biggest thing is utilization, some kind of, whether that's entries or enrolled or some type of utilization number. People want to see that, these facilities, centers are getting used. I think that's a big one.
Agreed. Okay. Todd.
I would say number of contacts, just cumulative over time, number of contacts with the recovery center.
Okay. Amanda.
So I would say engagements and then ability or outcomes of is this individual able to get closer or complete self-identified goals.
Okay. Steve.
And I think that maybe unduplicated number served is more important almost to the stakeholders than number of services, because if you're serving, I know we're not necessarily serving meals or something. You can get a lot of services in, so contacts and stuff. So I think that's important. I also think that the idea of people, a percentage that met some type of goals, is really helpful. And if we have people that are unemployed or homeless that are looking to change that, maybe some percentages around that.
Okay. Stephanie Makapo.
I was thinking like the basic information, like who's using, where they're coming from, who's using the center, where they're coming from, what age group, stuff like that to help. Yeah.
Okay. Stephanie Cameron.
Yeah, I'd have to agree with everything that's been said so far. Another one I think that's important is like what outreach is being done. How often are we doing outreach? What communities are we providing outreach to? And then also like there's various different types of outreach, right? There's outreach to people who could benefit from services. And then there's like community outreach, which is really different. The other thing I was thinking here when you were talking is like, it depends on the stakeholder sometimes, right? So, local business owners want a specific type of data and outcomes. Law enforcement, they want a specific type of data and outcomes. County agencies, state agencies, and, it goes up the line depending on where the money's coming from. But the one that I thought was really important is the unduplicated numbers and then the encounters or how many times has somebody engaged The other one I really liked, so we track goals. I think it's really beneficial to say, like, this is through these unique individuals, these are how many goals were set, and this is how many were achieved. But that could be too vague. You know what I mean? If you talk to somebody from, the medical sector, they really want to know diagnosis outcomes. So it just kind of depends on
Okay.
who the stakeholder is.
Okay, Frank.
Yeah, thanks, Tony. So, some good, some good highlights for sure. I think if we're going to track utilization, we better track expenditures.
Okay. I got Michelle here, and then also Craig. You guys are both working for OHA, so it'd be interesting to get your perspective on this.
Well, I have to say I'm really impressed with what people have said already, and I don't know if this is because you forced everybody to say something, Tony, but thanks for that. I think, I'm trying, what you want to show generally is that these are effective and they're a good use of money and resources. I don't know if knowing how long people have been in recovery among the people who are there, like I think just showing that some people have been in recovery for 6 months and some for 5 years, uh, that shows doesn't directly show they work, but it gives the impression that they work and that long-term resources are needed. Um, but yeah, this is a great list. I'm impressed with these data indicator metrics or whatever we're calling them.
Yeah, thanks, Craig. Michelle, if you're tracking.
Couldn't find my unmute button there. Yes, I'm with Craig. These are great. I don't really have anything to add.
Okay. The social determinants of health, which aligns with, recovery capital. I think that is really important to a lot of external stakeholders. Um, how many people retain their housing? How many people found employment? How many people went to school? Some of those things I think are really important to hit on, whether that's through the peer services or the recovery community center. And then what seems to have turned into a controversial thing in recovery is you know abstinence, and I don't think it's controversial. I think we need to move away from, like, is it like shaming for people if we ask them if they've been abstinence, to realizing that there's other success metrics in addition to that, but that is one for a lot of people. It doesn't mean we have to UA people at the recovery center, but maybe it's just a survey to ask people how long they've been abstinent for, or something like that. And that's just one of many data points that we could collect. Todd and then Stephanie.
I have two comments. First one on what you just said. We've been struggling with that, counting abstinence, yes, no, positives, negatives. Essentially, what we do now is we keep track of the number of substances within the last 6 months. So for those students or those kids who are, they're not using fentanyl, but they're still smoking weed, you know, there's a benefit there, you could say. And so you get to count that if you're surveying them. And the question is number of substances you've used in the last, whatever, 3, 6, 9 months. So that's one thing. And then the other thing I just wanted to mention is I don't know quite how we would do this, where the data lives, but I would love it if there was some indicator of decrease justice system involvement for folks that are coming to recovery centers. And the reason why, I mean, we're framing a lot of this around where some money is potentially, medically. Justice has oodles of money. And they have a hard time even getting it out sometimes. So I think there's opportunities to go after that as well.
Yeah, recidivism or decreased crime. Yeah, and we know that happens when people get into recovery. Stephanie, go
Yeah,
ahead.
we know there's a real easy way to ask about abstinence without like stigma or judgment. And we just ask if abstinence is a part of their personal recovery plan. Like, is that just a component? And because it's a safe environment, they are, for some individuals, they already know that they're not going to be judged if they have already shared that, yeah, I'm not using fentanyl anymore, but yeah, I smoke weed. Weed's not my problem. They know, like, for us, that is a matrix forward in the right direction. And then, just asking the question if it's a component is a lot less like invasive or scary to answer than like, have you stopped using? Like, are you still using? It's like, is this just a component of what you're already doing?
Okay, so I feel like I can pass it back over to Will, but it sounds safe to say that this committee agrees that we want to track sort of a wide variety of data amongst our clients now, and how we do that is equally important. My recommendation would be with peer services, people enroll in the one-to-one peer services. That would be sort of a unique data collection, um, method or process or specific data points. And then with the recovery drop-in centers, we do like a point in time survey once a year, where we ask people to anonymously, fill out a survey. And we could really look at a lot of different data just beyond trying to um, report out to stakeholders. What I've found over the years of 4D, and I've been doing this for a long time, is that I would ask like a lot of questions, about all sorts of stuff. And some of it sort of feedback, qualitative discussions, but some of it would just be like questions that sort of give me insight into what the community sort of needs, what sort of drug trends are out there, what people are interested in doing. And then each year I improve my programming based on that data that I would collect. And so that's how I probably see it being the easiest way moving forward. Will, I'll pass it off to you to get into some more of the data specifics and concepts that you created.
Sure. And I guess what I'm going to share is potential just sort of like framework for looking at this stuff that comes from our definition. And like everything I've heard so far about different types of reporting and whatnot seems to kind of fall into this sort of framework in one way or another. And like we're talking about, Tony's talking about some like methods of doing that, and we can think about how those might fit into it as well. Okay, skip those. I know this is like a busy slide just to start off with, but bear with me a second here. So this all of this comes from our definition. Um, at the very top, I have our definition, and it's cut off because it's really long. But then this middle chunk of words is that's all the things in the definition that can be measured. So I went into the definition and just pulled out things. I'm like, oh, that could be measured in this way, and I don't know all the ways. This is sort of what I pulled out. But it's like in the definition, we talk about it being non-residential, peer operated, paid director. Like those are yes, no questions. Okay. I mean, but when you get to say, well, here I mapped it out for social activities, if you see that. So social activities measures for an RCC could be made up of like number of activities, frequency, number of participants. And each of these elements, you can do the same thing for those relationships, community resource connection, social service connection. Um, and so a lot of the things we all just talked about I was kind of seeing where they would map into, our definition. So those are all the things in our definition that can be measured. The big one in the bottom right is recovery capital, because in our definition, we sort of imply that, we are building recovery capital by doing all this other stuff, right? So that needs special attention, the recovery capital piece. So when you add those things in the definition that can be measured to things outside the definition we want to measure, which Tony got into a lot of those, some of you got into a lot of those. Maybe that's like a survey or something, or a screening for where someone is at in their recovery. And the idea is, we combine these measures, and then at the bottom, it's like so. This is a set of measures that could let us tell the community about recovery community centers, and that could be a lot of different things. It could be data, story, a report, a survey. And so I want to go back to recovery capital here because there's a lot centered around it. So this is just recovery capital, the potential resources an individual could use in their recovery journey. You got 4 domains: personal capital, social capital, community capital, and cultural capital. And all made up of those things in the bullets below, kind of what you'd expect. So if our definition is saying, we got to essentially measure recovery capital or speak to building recovery capital. Again, on the left side, I have those pieces from our definition. And like as it turns out, they directly map to certain domains of recovery capital, like link to culturally specific services, maps to personal and cultural domains. Peer support is all of them. Community resource connection maps to personal and community domains. So really what this is showing is that all of those things that like we just talked about and the brainstorming we did, those fit into the elements of our definition. And the elements of our definition fit into recovery capital domains. And so measuring that stuff is measuring recovery capital at the community center level. And so, there's also measurement that can be done at the individual level of recovery capital. One of those is the BARC 10 screening instrument. It's a scale of like 10 to 60, I guess, and you answer those 10 questions. And maybe there's a world where someone receiving services does this BARC 10 and then does it again 30 days later or 90 days later, something like that. And then, we can track individuals' journey, over those time periods. So yeah, I guess I see this as a framework. And I know, Steph, we had talked about sort of moving forward and like unity together in this reporting. And I had a few things to say about that.
Yeah, if I could just jump in real quick, Will, I think us getting on the same page for data collection and what we can and want to collect and then presenting that is going to be really important for any of us who are trying to braid multiple funding streams together to provide services, to meet outcomes. And then we're using that braided funding to piece together our recovery community center. We know how hard it is to be reporting to multiple different contracts, multiple different outcomes, some outcomes that necessarily don't even really align with the work that we do. I mean, it does to some extent, of course, but different contracts, different funding streams have specific data that they're trying to collect. And so if we can all as a community get on the same page for the data that we know that we're collecting, the data that we want to present as the most important data to collect, then we can use this to influence potential contracts if and when they come. The other thing I'd just like to mention is we all have a really solid, professional experience on what data we can collect and what data we're already collecting. So I think when the definition aligns so much with data points, and when those data points are already being represented in our experience of what we're collecting, I think we're in a really good place.
I'm just wondering whether it would be helpful to just get a summary of the type of data that the current recovery centers are collecting, either administratively or through surveys. Just it would be helpful to know, and then there would be ideas there for what would go into what I think maybe we're leaning towards of a standard protocol of what data to collect.
Yeah, thanks, Craig. And Annalise, do you wanna hop into your hands up?
No, I had a comment, but if somebody wants to answer Craig, you all have better answers for Craig. I mean, Will can probably answer. I think that's some of what we did at the summit.
Yeah, and one of the issues with just so looking at what we currently collect is a lot of us have braided funding kind of miraculously, or had a lot of ingenuity around it to piece together our recovery centers while also reporting out on 4 or 5 different grant requirements. But it's not a bad idea to do a survey and ask people like exactly what they think to get some additional options. Go ahead, Annalise, with your comment.
So my comment is kind of I think taking these past 3 comments, Stephanie's comment and Craig's question, your response, Tony, and flipping it to tie it back to the definition. So I think from the ADPC perspective, what we're trying to do is to take your all's experience, right, and say, okay, here is what best practice for a recovery center if we were going to fund a recovery center and not just force folks to kind of piece it together. But the big thing is to say to any state agency that's funding a recovery center, if you're going to fund a recovery center, this is what it looks like, so that we make sure the funding's going to what we intend it to. And now this part is for us to say, if you're going to fund it, these are the measures that we need you to collect. So, it's that like bottom up and down up, because then we'll have the collective information from all of your centers together to make that case to show how effective they are, or where we might have to adjust going forward. So I just wanted to add that lens of, kind of how this roll the tape forward a little bit for how we see this kind of hopefully playing out in the future.
Thanks, Annalise. And Will, did you have more content to go over?
No. Well, I could share something I'm hoping that at some point, might make sense for us to do just real quick. We were kind of already doing it.
And then I got a proposition for next steps.
Yeah, so well, yeah, okay, I understand. This is something that I just sort of began on my own, and I don't know the best measures. I just kind of put them in there as a placeholder. But sort of, those are the pieces of our definition again. And, at some point, maybe as a group, we could brainstorm, what measures we see tied to peer support or recovery capital or mutual support meetings. So you got the left column with the piece of the definition and then the right one with potential measures for it.
Here's what I propose, because everybody's busy, and there's been a lot of good ideas. I have a ton of data already. I have some data reports that I've put together in the past with more than just 4D's recovery centers, and just sort of a comprehensive recovery center outcome thing when I was trying to pitch funding years ago. So what I propose is that if you have data you're collecting or any reports that you've created, send those to Will. Me and Will and Stephanie, if you want to join, yeah, feel free. But we'll go take everything from today, and then we'll come back with a concept for everybody to sort of mull over, sort of keep the progress rolling. Bring you guys back something a little concrete, that we can wordsmith or change here and there. And that way it's, a little more expeditable.
Yeah, we have an internal report for all services provided, and that we use that for ourselves. So just for clarity, are you asking for like our internal report
Yeah,
systems?
like if you're, like what you track internally that's sort of meaningful to your recovery center.
I love that idea.
Okay, we'll have a little work session, Will. All right, then I think the only thing left was public comment. Anybody here from the public want to comment on anything?
And Tony, I did not receive any written comment.
Okay. Okay. So little preview for the future. Okay. So there's been ongoing deliberation in the sort of, I'll say, peer community, around, fidelity, best practice, and I believe OHA is sort of working on that a little bit. There's some stuff going on with OHA. We have it in our plan to sort of work on that. And so I'm hoping that this group in the future can help, provide some clarity around that. In a pragmatic way. A lot of what I've kind of seen can be really philosophical, and they're great debates, and some they're philosophical and really dependent on individual organization or individual perception on what it means to be a peer. But for this group, I'm hoping we can help develop something like really concrete and operational for state agencies and contractors, to have some uniformity and sort of how they're contracting out with everybody. So that's just a little preview of the future. And then, Annalise, I don't believe I remember it coming up in your director's update. And I may be off, but wasn't there something coming with sort of the background check process that we may be engaging in?
Yeah. Thanks for that reminder, Tony. So folks who participated in or who were tracking the Governor's Behavioral Health Talent Council, there were a series of recommendations that came out of that. One was a recommendation that the ADPC convene a work group to look at background checks. We are currently having conversations with the governor's office about, and the talent council members about what exactly was intended there, to determine the precise scope of that. The Oregon Department of Human Services background check unit is actually has been doing a legislatively directed report that's due in June, and we'll have some recommendations in September. So a little bit of buzz, like Tony said, kind of happening, much like in peer support, happening in background checks. And so more to come on that, whether that's a separate work group that will be asking for people across committees or exactly what the scope of that is.
Yeah, and from my understanding, I mean, around the background check process for the years that I've been involved, you know, the friction is related to like safety and inclusiveness. You know, so some people are worried about safety. They want to make sure there's good disqualifying criteria for individuals who may pose a risk to clients getting served. And then there's been a group of people, mostly in recovery, who are like, we did pose a risk at one time. Now we pose a benefit, and so that's where I've seen the friction at. So hopefully we get weigh in on that process and help, have something that makes sense where it does meet that threshold of safety and qualification, but also gives people a chance to enter the workforce who've had, a colored history. All right. Well, that is it from me, and I'm happy to end the meeting a little early unless you have anything else, Will.
Not.
If you guys want to stay and chat, then that's cool too, but it looks like people are busy.
Do you have to make a motion?
No, we're not that formal.
Thanks, everybody.
Everyone.
Later.
Bye.
Will and Alice, do you guys want to stay on?
Yeah.
Looks like